A lawsuit brought by the U.S. Department of Justice against the state of Maine has been settled now out of court. That announcement came today from both sides.
The DOJ was suing the state because it said Maine was not doing enough to provide behavioral services for young people that would allow them to stay out of institutions and live closer to their homes and their families.
With my son's in crisis again, there's no place for him.
We first met Christine Adams back in September when the U.S. Justice Department announced it was suing the state of Maine because it had inadequate residential services for young people with intellectual and developmental disabilities. Adams' son, Christian, has severe autism, is nonverbal, bipolar, and has other challenges. The 21-year-old lives in a group home but went into crisis back in the spring.
And he threw all his toys out the window and his clothing, and I guess he was leaning out a second-story window. I was afraid for his life.
He ended up in the ER at Maine Medical Center for 10 days, waiting for a treatment bed at Spring Harbor, the state's only residential program that accepts young patients with intellectual and developmental disabilities. A similar stay in the ER in 2021 lasted 3 weeks.
Why isn't there any help for him? Like, why can't he go? Why isn't there a crisis bed for him? Like, how can other people... There are beds available, but not for my son.
Adams sent this letter about Maine's lack of treatment beds and services for people with disabilities to the Department of Justice. In it, she accused the state of segregating children with behavioral health problems and disabilities in hospitals, residential facilities, even the Long Creek Youth Development Center. Adams believes her complaint helped spur the lawsuit accusing the state of violating the Americans with Disabilities Act. Governor Janet Mills now says the state has settled that lawsuit, saying that while she's confident the state would have won, she asked herself at what cost, adding that protracted, expensive litigation would only have detracted from what's most important, continuing to improve our children's behavioral health system. The governor's office also pointed out gains the state has made over the past few years, spending $260 million to improve children's behavioral health services. Her office says the number of children in-state residential treatment has gone from 290 to 192, and those in out-of-state facilities dropped from 250 to 69. And the wait list for home and community-based services is 42% shorter than it was 2 years ago. As much headway as the state says it has made, there are still hundreds of young people and their parents who are still waiting for services that would allow them to live at home or closer to it. As for the settlement between the state and the Department of Justice, it will be enforced by a federal district court, and an independent reviewer will make sure the state is complying with that agreement.